When we're born, we have a natural crystalline lens, and eventually as we age through many different factors, this lens becomes more cloudy. So in some patients it happens faster than others, but generally cataract involves degeneration of the natural lens of the eye. Some of the general symptoms that people notice are clouding of vision, general haze. Sometimes patients describe it as smoky vision or through glare in the lights that they see. They notice it more when they're driving or when they have direct exposure to light. So imagine sometimes when your car is too cold and then your car fogs up a bit, and then imagine a car coming towards you with its headlights. So sometimes that's what the lights of incoming car or a lamppost look like. So it depends on the kind of cataract that you have. So some cataracts just occur due to aging. Eventually, at one point or another, all if not most if not all people will actually have cataract. So it just depends on how fast your lens ages, pretty much. In some patients, it might be faster, especially in patients with other diseases such as diabetes. So diabetic patients usually have cataracts forming earlier than the regular person would. Sometimes if the eye has an injury or a trauma, there is a greater chance of having cataract formation. So there are many different forms of cataract surgery, but all cataract surgery involves extracting the old degenerated lens from the eye and replacing it with an artificial lens. These artificial lenses are usually tested to be biocompatible with the eye. So one of the most common misconceptions that I've heard is that the cataract has to be ripe, or in our term, hypermature, before we can take out mature before we can take out the cataract. Well, we don't really have to wait for the cataract to be ripe or mature before we take it out. When the patient experiences significant visual changes, even if the cataract is not quote-unquote ripe yet, we may already take out the cataract for the benefit of the patient. I wouldn't say misconception, but people usually ask, can the cataract come back after cataract surgery is done? Actually, what happens is that the cataract will not come back, but sometimes there can be clouding over the implant, it's just a natural reaction of the body sometimes to the implant. Or sometimes when we do cataract surgery, there are microscopic lens cells that we won't be able to take all of your cataract out. We'll be able to take most of it out, but there are microscopic cells which remain and then they regrow. But this is not actually a cataract, it's just an opacity on the lens which we can do laser treatment for.